Good morning. I'm Don Walker, and I'm Communications Director for Brevard County Government, and we are here this morning for our biweekly update on the COVID-19 pandemic. On our panel today, we have Anita Strimmel, who is the Assistant Director of the Florida Department of Health, Brevard. We have John Scott, our Emergency Management Director, Matt Wallace, who is our Director of Public Safety, and we also have Jessie Ray, who is our County Social Media Specialist. She will be monitoring our Facebook Live for any questions that you might want to pose to any of our panelists. So feel free to type in your questions, and we'll try to address those before our program ends this morning. So to begin our program, we will lead off with Anita Strimmel for a pandemic update. Anita?
Thank you, Don. I am Anita Strimmel. I'm the Assistant Director at the Department of Health in Brevard County. Some updated data for you regarding our cases and vaccination. As of today, we have a total in Brevard of 35,186 cases. That's an increase from yesterday of 104 cases, or the day prior, with a daily positivity rate of 5.4%. Our overall positivity rate, so all cases combined, is 13.62%. We stand right now at 772 deaths, which is an increase of 4, sadly. Our hospitals, they remain stable. There's no concerns regarding capacity at the hospitals. On the vaccine side, there's been 103,139 doses administered in Brevard County. 55,632 individuals have completed the entire series. That's 2 vaccines of either the Moderna or the Pfizer or the single Johnson & Johnson. Looking at a 2-week trend, and that's from February 25th to March 10th, the number of cases per day ranges from 67 to a high of 154, and our positivity rate ranged from 4.48 to 8.87. Our average positivity rate over the last 2 weeks is 6.04. That is a slight decrease even from the previous update that Maria Stahl provided last time. And while we are trending in the right direction, now is not the time to loosen up on any of our precautionary measures. We could just as easily swing the opposite direction. We need to continue hand washing, wearing face masks, social distancing, and please stay home when sick. Thank you, Don.
Thank you, Anita. We appreciate it. And it's very important to take heed to what Anita said, because we realize there's a lot of spring breakers that are headed to the county. And so, you know, it's best to protect yourself and protect others around you by following those CDC guidelines. For an update on the vaccine program, we'll turn it over to John Scott from Emergency Management.
Good morning, everyone. Again, my name is John Scott. I am the Director of Emergency Management for the county. I want to talk about a couple of things today. I want to start by focusing on groups that are eligible. I know there's some confusion, and understandably so, because there's a little bit of mixed messaging when it comes to federal guidance versus state guidance. So I just want to walk through what that looks like right now. So currently, in the state of Florida, the guidance is anyone 65 and older, sworn law officers 50 and older, K through 12 employees 50 and older, and firefighters 50 and older, along with the residents and staff of long-term care facilities and healthcare workers with direct patient contact. So that is who's eligible currently under the governor's executive order. Many of you have also seen that the governor announced earlier this week that he's going to expand that group a little bit to include those individuals who are 60 and older. That takes place, that goes into effect next Monday, the 15th. So right now, the age eligibility is 65 and older. Beginning next Monday, it'll go to 60 and older. All right? I know we talk about those individuals who, from 18 to 64, who have extreme vulnerabilities to COVID. And there's been some questions on what that means and who that is. The short version, the best way to remember that is, in order to be someone who is qualifies as a 60, you have to be 18 to 64, and be extremely vulnerable to COVID as recognized by your physician. So your physician has to sign basically a doctor's note, an attestation, saying that yes, you meet that criteria. And that criteria is broad, which is why we need that physician's verification and attestation. And you can get that DOH form on the county's website or on the Department of Health's website. You go right to our COVID section on the county website. It's right there in the highlights. You can download that form, get your physician to sign it, and then that makes you eligible. Right now, those individuals who qualify, who are deemed extremely vulnerable to COVID, who are 18 to 64, can get a vaccination at either hospitals or pharmacies. One of the things the governor's executive order did that goes into effect next Monday is he broadened the groups that could do it, who could provide the vaccine to that group. So what will happen is on Monday, in addition to expanding our groups to include those that are 60 and older, also if you're someone who has a signed note from your physician, preferably on the Department of Health's form, then you can also get a vaccination at any site that is providing vaccines. So that could be a pharmacy, that could be a federal site, which I'll talk about here in a little bit, or that could be our site at the Department of Health in Vieira. So all of those things are applicable, but that starts next Monday. Again, right now, if you are in that category, you are limited to pharmacies and hospitals. So Monday, we're going to see that expansion. We just have to continue to be patient and wait for those. A big point in all of that is just because you're now someone who is eligible, you weren't previously, that doesn't necessarily move you to the front of the line. Unfortunately, we're still in a situation where our supply does not meet our demand, which means we have a lower supply than those who are interested. So there's a line. So as you become eligible, you essentially are now competing with everyone who's already been eligible and hasn't received their shot yet. So that does put you towards the back. We do ask that folks be patient, just like we always have said in these events. We need your patience. We're getting there. You heard Anita talk a little bit about where our numbers were. Incrementally, we continue to improve. We continue to see a small increase in vaccine supply. Again, nothing that's going to meet our demand. We're not seeing, radically, going from 5,000 shots to 25,000 or 50 shots. That's not where we are yet. But we are seeing a little bit more, and we're seeing more providers come online. So we're seeing more options for folks. I talked about some of the federal sites. There is a federal site in Orlando that has a broader criteria. And one of the best examples I can give on that is teachers. So K through 12 is what the governor's order is and what we follow with the Department of Health and at those state-supported sites. But the federal folks are doing any teacher of any age. So if you're at, just to clarify, so if you're coming to a state site of the Department of Health, you have to be a K through 12 employee, 50 and older. If you're going to go to a federal site in Orlando, that's any age for educators. So again, those differences exist. I know that's confusing. That is also the same when it comes to pharmacies. If you're a teacher of any age, K through 12, then you can go to a pharmacy and get a shot because they're supported directly through the federal allocation and they follow the federal guidelines. Again, I know that can be a little confusing. We just ask folks work with us. When in doubt, always call that place. Say, hey, I'm coming there. This is sort of how I think I meet the eligibility. Is that correct? You always want to bring with you a form of ID so that if you're in law enforcement and you're sworn, you want to be able to verify that. If you are a K through 12 educator, you want to be able to bring your school ID. Same thing for firefighters. Again, if you are someone who is 18 to 64 and extremely vulnerable to COVID as determined by your physician, you want to make sure you have a form verifying that so that you can provide that and that you can get your vaccine. I know that's a lot of nuance. That's just sort of where we are right now. The big takeaway is we have more options now than we had 2 weeks ago, and I'm confident we're going to continue to see more options in the weeks ahead. It will change. This is a very dynamic and fluid situation. We've said that a lot. We're asking folks to hang in there with us. We're asking folks to go wherever they can to get information. If you're looking for the latest information, you can come to our website. Again, you go to it there. It is, you find our COVID. If you go to the county's website or you go to www.embrevard.com, across the top is a red banner for COVID. You click on it, you click the vaccine icon, and you'll get the latest eligibility criteria there. I know the Department of Health puts that information out. You can follow us on social media. You can follow the Department of Health. They have a great website on their COVID updates, both locally and at the state level. So there's a lot of information out there. Just hang in there with us, continue to work with us, and let's stay positive together. Don?
All right, and a couple of things just to add to what John said. I mean, he mentioned the state registry, which is at myvaccine@fl.gov. But even if you've registered on the state registry, enhance your chances. If you see that Publix has appointments available or any of these other agencies or retailers that John mentioned have appointments available for vaccine, by all means, please go to those sites and see if you can get appointments. We know there's a great demand out there, as John mentioned. So, do whatever you can to help enhance your chances for getting that vaccine. I also wanted to mention that as part of our assistance to the community, we know there's a lot of hardships out there, whether it's due to layoffs or other financial conditions that have stemmed from the pandemic. The county implemented a couple weeks ago a rental assistance program that is backed by $18 million in federal money that we're trying to get into the hands of those who live in Brevard County that need rental assistance. So far, we've had 428 applications, with the average grant being $2,400. But one of the things I want to mention that's really important is that 35% of the applications we've received have had to be returned or denied because of incomplete information. So if you're filling out an application, be sure to follow the step-by-step process to complete that application. A lot of the things that we're finding that are missing that we need to process those applications are pay stubs, W-9 forms, and other type of income information that's needed to show us that you truly need that assistance. And we certainly want to get that money in the hands of our residents as soon as possible because we know the need is out there. So please do your diligence, please, if you can, make sure you complete those application forms to their fullest before you submit them. Those applications are available at all 17 county libraries, and they're also available on the county website at www.brevardfl.gov. I will now turn it over to our Public Safety Director, Matt Wallace, for an update on some other funding mechanisms that are on the horizon. Matt?
Thank you. Thank you, Don. And good morning, Brevard County. Thank you again for tuning in with us for these biweekly updates. We've seen these biweekly updates transition over the last year or 8-10 months that we've been doing them. We talked a lot about testing at the start, and now we're talking a lot about vaccinations. So that progress that I've seen through these communications and the progress that we've seen in the actual execution of our COVID defense operation has been good. It continues to incrementally get better, and as more vaccines continue to get out to the public and get in the arms of our people, we will continue to see that progress. There's two really good data points I'd like to just quickly share where we are in Brevard County. The first one is we just reached a milestone that of our population over 65 and over, we're over 50% of those folks at least having their first vaccine being administered. I think that's a pretty awesome data point considering we started this in January, and here we are sitting in March, and we've gotten to that point for one of our most vulnerable populations that we have in the county. Another data point that was slipped to me is your Emergency Operations Center in Brevard County has now been active for just a little over a year fighting this pandemic. They're on the front lines. They're working with the Department of Health and all our wonderful partners that we have throughout Brevard County to make sure that we make a difference and keep our community safe. Public safety is a tenet of county government, and our Brevard County EOC, our Florida Department of Health, and all the wonderful people who've worked to make this happen. It's just a testament to them and a huge thanks of where they've been. Don touched on it a little bit. In the news, if you've been keeping up, there are several federal programs that are currently on the cusp of being distributed. One of those is the next federal COVID relief program. Our analysts have been telling us that we are looking between maybe $115 and $120 million that could potentially be targeted to Brevard County. We are hearing that those could be sent to us in 2 chunks, and the first chunk arriving soon. Staff is currently looking diligently at the implementation instructions that we are getting from the federal government, and we'll be getting those dollars and those programs updated here in the very near future as we get more information on what we can and what we cannot spend those dollars on. So I think it's, again, another wonderful opportunity that we have to support the citizens of Brevard County through this federal relief program. The other portion of the federal relief program, obviously, is the individual assistance checks that would be coming out. Please keep watching the news of when those you should be seeing those. There's all kinds of stipulations and conditions for those individual stimulus checks too. But we hope to have those, I know the federal government rather hopes to have those in our hands as quickly as possible so we can make a difference. Again, I'd like to publicly thank everybody on this panel for all the due diligence and all the fantastic work that we've done to combat this virus. I mean, it has been a war, and it is a marathon, and we continue to sprint in this marathon at times and then relapse and figure out what we're going to do and then sprint again. But we're not done with the race. The race still has a little bit to go, so stay with us. Please be patient. The more that time passes, the more vaccine supply will continue to hit the county, and there'll be more opportunity for us to continue to do the right things for our folks. So again, thank you for tuning in with us. If you have any information, please don't hesitate to reach out and contact us, and please continue to tune into these bi-weekly Facebook events so we can get that information out to you. Don, thank you so much.
All right, thank you, Matt. And I know we've mentioned a couple of websites during our conversation this morning, and when the program ends today, we will post those websites at the end of this broadcast, so you'll be able to jot those down if you need to. For now, I will turn it over to Jesse Ray for any questions that we may have received from our audience.
Awesome. Thanks, Don. So yes, we do have a couple of questions, but since you just talked about the website, I did want to just kind of show people what John was talking about, where they can get that form on our website. So Logan, if you can, yes, thank you. So here's our main page on our website. This is the red bar that John was talking about. You have COVID news. You also have COVID vaccine information. Both of those pages have a lot of really good info on it. But for right now, we're just going to look at the COVID vaccine information page. If you scroll down here, we've got some key points and some other important information. But right here, this link right here, the Florida Department of Health's COVID-19 Determination Extreme Vulnerability Form. You click on that, and that's going to take you to that form that we've talked about. So I just wanted to give everybody a chance to kind of see, again, where we find that. You just go to brevardfl.gov. Like Don said, we'll post that at the end. And you go over here to the red bar. You click on vaccine information. You scroll down to this link right here, and it will take you to that form. Okay, so moving on to a couple of questions. Can you explain in more detail the logistics of how people ages 60 to 64 can sign up for the vaccine as the ages get lowered on Monday? Can they sign up now, or do they have to wait until Monday?
All right, I'll take that one. So I'll start with that. If you are sort of in that 60 to 64 age range and you're waiting to be eligible, if you are looking to sign up on the state system, you can do that now. That doesn't mean you're going to get called. You won't get called until you're eligible and when that sort of appointments begin to happen, but you can do that today, tomorrow, whenever you'd like to. When it comes to pharmacy programs, those slightly vary. So if you're trying to get on Publix and that, they are slowly incorporating that, but it may not be 100% effective where you can go on any of those sites and sign up until Monday, but that is where we currently are.
Okay, thank you. Federally run vaccine sites, including the one in Orlando, are offering vaccines for teachers. Is there any plan to offer that in Brevard County?
So I'll take that one again. So let's talk about our educators. So yes, and I touched on it earlier again, federal sites like the one in Orlando are educators, daycare, all those folks, any age, because that is the federal guidance. The state guidance, where you might find it at our site at the Department of Health, is K through 12 employees 50 and older. You can sign up right now on My Vaccine, which is how we schedule appointments for those at the Department of Health site in Viera, and you'll be placed in line. I will also say that we worked very closely with the Department of Health and the school board to set up what we call a closed pod, or something just for those newly eligible groups, so those teachers or those K through 12 sworn law enforcement and firefighters. We worked directly with the school board on that to identify their staff who is eligible. We'll be hosting an event for them, along with, I know the school board has been working very closely with our private and charter schools to make sure we're not missing any of those folks. So they are coordinating and scheduling directly with them. We are also coordinating and scheduling directly with law enforcement for a specific pod for them this weekend.
Okay, excellent. John, any ideas on when mobile vaccination might be happening?
So the short answer to all of those things is when supply gets us to that point. We obviously have plans in place to do those kinds of things. And in a very small scale, when we can, we do try to move it around a little bit to the county to some very targeted populations who we've identified as having access issues, transportation barriers, those kinds of things. Hopefully, as vaccine supply continues to increase, we will be able to expand those programs. Right now, I can't speculate on when that's going to happen, other than to say it's tied directly to the amount of vaccine supply we get.
Okay. Anita, is contact tracing still happening?
Absolutely, yes. We still have a very large staff of contact tracers, and they are absolutely reaching out to those positive cases.
Okay. How is the COVID relief bill going to affect vaccine availability, distribution, and eligibility? Is there any
I'll take that one.
effects?
So, like Matt outlined, it's very, very early in that process. We're still digesting that. I mean, I think the big benefits are we know there's going to be money allocated to support vaccine operations, whether that's sort of upfront or in a reimbursement process. We'll figure that piece out, so that will make it easier for local and state governments to supply it more. But at the core of this is always the vaccine we get from the manufacturers. So as production ramps up, as we get more of those things, you will see supply continue to increase. I think probably the largest way that the bill will affect our operations locally is it will provide a reliable source of funds to support that. But very, very early, more details to come.
Okay, excellent. Thank you. Somebody asked, how do I remove my name from the state? It's not our site. It's the state waiting list now that I'm vaccinated.
So one, thank you for being conscientious. We appreciate that. Two, there is a helpline you can call, and that number is on our website. That they should be able to remove your name.
Okay. So we've talked about the fact that there's a physician requirement for some people to be able to get vaccinated. For new Florida residents who maybe haven't quite had the chance to get a new physician just yet, do they have to get permission from a physician licensed in Florida, or can their provider from the state that they just moved from complete the form?
I can take that one, Jesse.
Okay.
Yes, it does have to be a physician who is licensed in the state of Florida.
All right, so we've got two more questions we'll take, and then we'll end our program.
Okay. So two more. What kind of info do we have or do we share about treatments or early treatment for those who are COVID positive? Is there anything that they do? I'm not sure. I kind of asked for clarity on this question. I'm not sure I totally understand it.
Well, okay, I can perhaps address that.
Okay.
So if you have a mild case of COVID-19, you just have to wait it out, basically. If it gets to the point where you're having shortness of breath and you're having greater difficulties then that's when you need to seek medical care.
Okay.
And I just want to add on that
Yes.
piece there, just, and this is important for all things medical, and I think, Anita, you would agree, is
Absolutely.
always, if you have any questions, if you are diagnosed with COVID, immediately check with your physician. Don't be afraid to just go to them and say, hey, I've been diagnosed with COVID. What do you recommend? What are the best steps? Because they know your individual health, and if there are cautionary tales or something that they're worried about, I think sometimes that's a step people forget about, is just, if you have a doctor or you've seen a doctor recently, it's a good step just to say, hey, am I on the right path?
Okay. And last question. So there's lots of information about Johnson & Johnson, the Janssen vaccine coming out. Does the county have it yet? Is that being distributed around Florida just yet?
So I'll take that one as well. Just, yes, very excited. We talked about it last week. We thought Johnson & Johnson was coming. It's here. We're super excited that it is, a new weapon in our fight here against COVID. Do we have any in the county? Not directly at the health department currently. We know they are starting to circulate at some of the federal sites. We know we do have some in the state, and we're waiting to see how that allocation breaks out. But we'll continue to receive Moderna and Pfizer in the county, and my guess is we'll start to see Johnson & Johnson in the coming weeks.
All right, so we're going to wrap up the program. I just wanted to mention, though, we talked a lot about making appointments today for the vaccine. At the FDOH site here in Viera, if you show up without an appointment, they will unfortunately have to turn you away because, again, the supply and demand issue. We are making appointments for people to show up. We are giving vaccines for the people that show up that have appointments, and unfortunately, we're having to turn away people that show up that don't have appointments. So, and then I also wanted to mention again, it is spring break time, but regardless of whether it's spring break or just a weekend in March, please follow the CDC guidelines. We're trying to get as many shots in arms as possible, but it's still very, very important to follow CDC guidelines, social distancing, hand washing, not going to work if you're sick. So thank you for tuning in, and we'll see you again in 2 weeks.